My name is Liza Creel. I am an assistant professor in the School of Public Health and Information Sciences and PI of the study that we're discussing and presenting to you today. I do this work with a wonderful co-PI, Dr. Debbie Davis, who is the director of the Child and Adolescent Health Research and Design Unit in the Department of Pediatrics in the School of Medicine. We affectionately refer to that unit as CARDS. We also have a great extended team of researchers and staff who've contributed to this work and this presentation, including Natalie Pasquinza, who's with the CARDS unit and is our project manager on this project, on this study, and Tiffany Cole Hall, who is Chief Operating Officer at Volunteers of America Mid-States, and they are our key community partner in this work. So we're going to really get started with kind of the framework on which we designed this entire study, and start talking a little bit about why community engagement. So this framework that you see on your screen in front of you was developed by the Robert Wood Johnson Foundation. They are our funder for this work, and they developed this in collaboration with some of their program partners. This framework really builds on what we know exists in many local communities, which is that there's organizations in multiple sectors who serve different people, serve the same people living in that community. And when we talk about organizations and sectors in this work, we're talking specifically about healthcare organizations, public health organizations, and social services organizations. And what this framework really posits is that there are these different sectors, these three different sectors, and that when those sectors align in terms of their purpose, in terms of data they report, or data they share, in terms of how their services are financed or how they govern and make decisions, that those aligned systems can actually improve health and improve community well-being, and may even impact well-documented inequities in a community. The framework also outlines that all of this really requires, and you can see this at the bottom of your screen, a very strong community role and strong community engagement. So those of us doing this kind of work really hypothesize that community engagement influences both cross-sector alignment, but also the well-being that we're trying to improve in communities. So our study examines alignment empirically, but because these systems are inherently community-based, we also integrate community engagement both formally and informally in our research, design, and implementation. So our study has a very long technical name that is just too long and does not roll off the tongue very well. And we wanted to really come up with a name that would resonate not just with community stakeholders, but also honor the women who fight for their recovery every day, hopefully with support of organizations in their community. So today we're presenting the Shero Study. This is an acronym for Strengthening Health Equity and Recovery Outcomes. This is funded by the Robert Wood Johnson Foundation, specifically through their Aligning Systems for Health program. We have three aims in this study. The first is to measure cross-sector alignment. So those three sectors, healthcare, public health, and social services, we are empirically measuring, quantitatively measuring alignment in two communities in Kentucky, both of which have a model of care called Freedom House. Freedom House is an evidence-based model of care for residential treatment, residential substance use treatment, and parenting supports for women and their families. The Freedom House model is operated by Volunteers of America Mid-States in both Louisville, which is in Jefferson County, and most recently they expanded about a year ago into Clay County. Sorry, I got distracted by a chat, excuse me. So we are looking at alignment of organizations in these two communities that you can see on the map, but also extending our work to really understand differences in those communities in a lot of different ways and how that facilitates implementation. Specifically, we're looking at rural and urban differences because we know Jefferson County and Clay County are quite different. Finally, we're exploring associations between alignment and client outcomes. So why study this? Well, you all know, as many in our state do, that the opioid epidemic has impacted Kentucky significantly. Opioid use doesn't just affect individuals, it impacts families and it impacts communities. And there are extensive health and social effects, some of which you see on the screen before you. What the other thing that we know about this is that opioid use and recovery outcomes are also moderated by many different factors. There are other important services and supports that individual needs, housing, safety, nutrition, just to name a few, that really the traditional healthcare delivery system can't solve. And so there's other local organizations that help meet public health and social needs for pregnant and parenting women in recovery. And if these systems align, or if these organizations are strongly connected in some way, we may actually observe improved outcomes. Okay, so why are we here today? We're here today to talk about community engagement. So why community engagement? Well, we on our research team do not have the lived experience of either the women seeking or in recovery, or of the organizations that may serve them. And so we needed to integrate those perspectives in both the planning aspect of our work and the implementation of our study, so that our work isn't just scientifically sound, but it's also meaningful in terms of policy and practice change. So our community engagement approach has taken kind of three strategies. The first is that we've partnered with Volunteers of America Mid-States as a community research partner. We've structured our research team to include staff members from VOA and to hire through VOA a new community facilitator who is a graduate of the Freedom House program. Volunteers of America also got us started in identifying their key community partners in delivering services to pregnant and parenting women. And they're also helping us with outcomes measurement. And this isn't just giving us data, which of course as a researcher is awesome, but this is also getting their input on and their contribution and listening to them about meaningful outcomes for women in recovery. And we're actually in the middle of this right now. And just the other day, the community facilitator that we've hired into this role called me after a few hours after we had had a conversation about outcomes and what we were trying to measure. And she said, I have an idea. Wouldn't it be great if we could know if women who were graduating from Freedom House had access to contraception at the time that they left? And in my mind, I'm thinking, why didn't we think of this before? But her perspective on what adds value to her ability to be successful in recovery really helped us extend some of our thinking around outcomes measurement. And so we're exploring that and based on her recommendation. We've also established a community advisory board to engage in conversations about our study design and implementation, but also around translation and dissemination specifically. We want to engage with community members to share our findings because we want them to be meaningful to the organizations that are part of these systems, but also to the community as a whole. Finally, we've also found several opportunities to engage women who have been served and who themselves and their families have been served by Freedom House. So we've hired a community facilitator who is a graduate, but we've also engaged current clients and graduates in conversations to inform our research about who they may have gone to for services so that we're adequately characterizing this system of care in both Jefferson County and Clay County, Kentucky. So talking just a little bit about the facilitators of our work and the challenges, certainly our partnership with Volunteers of America has been just incredible. We've had a strong partnership from the very beginning. We wrote this grant to the Robert Wood Johnson Foundation together. The team members over at VOA had a lot of input, not just on background, which of course was super valuable for us, but also on our design and approach. And their team and our team's commitment to improving health and well-being for this population of women and families is very clear. There's also been a really awesome opportunity to give women who have been served by Freedom House an opportunity to help other moms and families. We've heard this from women we've talked to time and time again when we share that we don't know that what we learn is going to help them individually, but that it may help other moms. And that's really what they want to do. And so we feel like this is a great opportunity to engage those with lived experience in helping others. The other thing that isn't up here is really, I was thinking about it this morning, kind of preparing some of my notes, and we've really participated in joint decision making. The decision making in this work is not just on the UofL side. I think we have a meaningful partnership around developing strategies and making decisions that strengthens our work. There are definitely challenges. Time, this always takes longer than I expect. Every single time I have to modify our timeline. Some related to that is some issues with hiring and turnover. So initially we had 2 people hired into the community facilitator position, kind of splitting that. And they were both wonderful graduates or women in recovery, but just weren't quite at a point in their recovery where they were ready for this position. So it took us a little bit of time to find the right fit for that community facilitator position. Another challenge we've encountered that we really did not anticipate was this balance that we have to do between intentionally hiring or engaging with women because of their lived experience in recovery, with the skills that are needed for some roles on a research team, like computer skills, like logging into and participating in Zoom calls, for example. Not necessarily experiences everyone has had. And so we've had to do some training and provide some support that we weren't anticipating, but is really paying off. There's also, of course, with external research partners, challenges around research training and getting paperwork around IRB in place. And Natalie Pasquin's on our team has really led our work around that and has done a great job. And I think can help anyone else who's has a challenge in that area for sure. I want to speak for just a minute before I ask Tiffany to share her perspectives about our experiences in light of COVID-19 and the racial justice movement. So we wrote this grant we submitted this grant in February of 2020. It was approved in April and started on May 1. So there are members of our study team that are in the community that we have never met in person. Meeting virtually is great. Teams, Zoom, wonderful, but not a perfect substitute. And that's true for our community advisory board engagement as well. We had planned to go to Eastern Kentucky to meet members of the community, and we haven't been able to do that. Many of the members of our CAB are also service providers, and so they too have competing priorities. And then lastly, I'll just mention, that both the inequities that have been exacerbated by COVID and that the racial justice movement have highlighted have really pushed us, along with input from VOA staff and our community advisory board, to be very explicit in our measurement and understanding of inequities. And to have a more focused exploration of the relationship between cross-sector alignment, inequities, and those structural and historical causes of inequities, like power imbalance or trust relationships. So we always sort of plan to look at health equity, but I think we're being much more deliberate there. And we're really motivated by so much of what happened in 2020. So I'm going to stop talking now and turn it over to Tiffany Cole-Hall, who's with VOA, to share their perspective on this partnership. Tiffany, there?
Tiffany's not able to get in. She keeps trying and it keeps asking her for a code.
Okay.
We've resent her the links that were sent to us, and none of them are working.
Okay, so I'm just going to run through this then, and I wish you all had the chance to meet Tiffany. She's really wonderful and has led a great team over at VOA. And I think what I will say here is that VOA not only implements evidence-based models, Freedom House is an evidence-based model, but they are and have been very active in community-based research prior to this project because they want to advance the literature and the body of science around service delivery at the local level. And I think really value an enhanced understanding of how they and others in the community can enhance client outcomes or improve client outcomes. It's also, of course, an opportunity for them to engage their graduates, which is a priority for them as well, and which they do in lots of different ways. There is our contact information. I'm at 15 minutes. My phone just buzzed. I do want to acknowledge Robert Wood Johnson Foundation for their funding of this project, and I'm happy to answer questions when the time is right.